Understanding blood pressure in adults, why it's dangerous, and how to fight it. Good day. Today we're going to talk about something that affects millions of adults worldwide, often silently, often invisibly, yet has the power to shorten lives, damage organs, and dramatically reduce quality of life. I'm talking about high blood pressure, or hypertension as doctors call it. Let's start with the simple question. What is blood pressure? Think of your circulatory system like a network of pipes. Your heart is the pump. Every time it beats, it pushes blood through your arteries, those flexible, strong tubes that carry oxygen-rich blood to every corner of your body. Blood pressure is the force, the push that blood exerts against the walls of those arteries. It's not a single number, it's two. The systolic pressure, the top number, how hard the blood pushes when your heart contracts, and the diastolic pressure, the bottom number, the pressure when your heart relaxes between beats. A reading of 120 over 80 or 120 over 80 mmHg is considered normal for most adults. But when those numbers creep upward, especially if systolic stays above 130 or diastolic above 80, things start to change. Not dramatically at first, often not at all. That's why hypertension is called the silent killer. You can feel perfectly fine, strong, energetic, even athletic, while inside, damage is quietly accumulating. So, why is high blood pressure dangerous? Let's begin with your brain. Elevated pressure weakens and stiffens the tiny blood vessels in your brain over time. Some may bulge, forming aneurysms, like weak spots on an old garden hose. If one ruptures, that's a hemorrhagic stroke, sudden, catastrophic, often fatal or disabling. Even without rupture, chronic high pressure can reduce blood flow, starve brain tissue of oxygen, and contribute to vascular dementia, a slow, cruel decline in memory and reasoning. Then there's your heart, the very organ generating this pressure. When arteries stiffen and narrow, a process accelerated by high pressure itself, your heart has to work harder, much harder, to push blood through. Over years, the heart muscle thickens, especially in the left ventricle. That sounds strong, but it's not. A thickened heart is less efficient, less flexible, and more prone to failure. Yes, heart failure. Not sudden cardiac arrest, but a slow, progressive weakening where the heart can no longer meet the body's demands. Fatigue, shortness of breath, swelling in the legs. These aren't signs of aging, they're warning signs. Your kidneys, your body's filtration system, are also exquisitely sensitive. They're packed with microscopic filtering units, each fed by delicate capillaries. High pressure damages those filters. Proteins leak into urine. Waste builds up in the blood. Over time, this can lead to chronic kidney disease, and in severe cases, dialysis or transplant. And let's not forget your eyes. The retina, the light-sensitive layer at the back, has its own network of tiny vessels. Hypertension can cause them to bleed, swell, or narrow, leading to blurred vision or even permanent vision loss. This isn't rare. It's hypertensive retinopathy, a direct fingerprint of uncontrolled pressure. But here's the critical point. Most people with high blood pressure have no symptoms at all. No headaches, no dizziness, no feeling off. You won't know until something goes wrong. A stroke at 52, a heart attack at 58, sudden kidney failure at 63. That's why regular monitoring isn't optional, it's essential. And yet, nearly half of adults with hypertension don't have it under control. So, how do we fight it? The answer is not just pills, it's lifestyle, deliberate, sustained, evidence-based change. Medication can be life-saving, especially when pressure is very high, but even then, lifestyle is the foundation. Let's break it down. First, salt, or sodium, is your number one dietary enemy. The average adult consumes over 3,400 milligrams of sodium per day, more than twice the recommended limit. Processed foods, canned soups, fast food, bread, even seemingly healthy snacks, they're loaded with hidden salt. Reducing sodium intake to under 2,300 milligrams, ideally 1,500 milligrams, can lower systolic pressure by 5 to 8 points. That may sound small, but in population terms, it prevents thousands of strokes and heart attacks every year. Second, move your body consistently. You don't need marathons, just 150 minutes per week of moderate activity, brisk walking, cycling, swimming, spread across most days. Why does it work? Exercise makes your heart more efficient. It improves artery elasticity. It helps manage weight and reduce stress hormones. Even 10-minute walks 3 times a day count, and they add up. Third, manage your weight, especially abdominal fat. Carrying excess weight around your middle isn't just cosmetic, it's metabolic. Fat tissue, especially visceral fat, releases hormones and inflammatory signals that constrict blood vessels and raise blood pressure. Losing just 5 to 10 kilograms, about 11 to 22 pounds, can produce a dramatic drop in pressure. For many, it's the single most effective non-drug intervention. Fourth, limit alcohol and avoid binge drinking. 2 drinks per day for men, 1 for women is the upper limit, but even that may be too much for some. Alcohol raises blood pressure acutely after just a few drinks and chronically with regular use. Binge drinking, 4 or 5 drinks in a sitting, causes dangerous spikes and increases arrhythmia risk. Fifth, don't smoke and avoid secondhand smoke. Nicotine is a powerful vasoconstrictor. It tightens arteries instantly, spiking pressure and heart rate. Carbon monoxide reduces oxygen in your blood, forcing your heart to compensate. Smoking doesn't just raise pressure, it multiplies the risk of heart attack and stroke in hypertensive people. Quitting is the fastest way to reduce cardiovascular risk, within hours. Sixth, tame chronic stress. Stress itself isn't evil, it's how we respond that matters. Constant activation of the sympathetic nervous system, the fight or flight mode, floods your body with adrenaline and cortisol. Blood vessels tighten, heart beats faster. Over months and years, this becomes the new normal. Techniques like mindfulness, deep breathing, try 4-7-8 breathing, inhale 4 seconds, hold 7, exhale 8. Regular nature exposure and quality sleep can reset your baseline. Sleep, especially, is non-negotiable. Less than 6 hours per night is strongly linked to hypertension. Aim for 7 to 9. And yes, sometimes, despite all this, medication is necessary. Diuretics, ACE inhibitors, calcium channel blockers, beta blockers, modern antihypertensives are safe, effective, and often used in combination. The goal isn't just to lower the number, it's to protect the organs. Your doctor will tailor treatment based on your age, other conditions like diabetes or kidney disease, and ethnic background, because responses can vary. But here's what many miss. Consistency is everything. Taking your pill every day, walking even when it's raining, choosing water over soda again and again. This isn't about willpower, it's about building systems. Put your blood pressure cuff on your kitchen counter, set phone reminders for medication, prep healthy snacks on Sunday, and list a walking buddy. Small, repeatable actions, anchored in routine, beat heroic one-off efforts every time. Finally, let's talk about low blood pressure, hypotension. While less common as a chronic issue, it can be dangerous, especially in older adults. Dizziness upon standing, orthostatic hypotension, fainting, falls, these aren't just part of getting older, they can signal dehydration, heart problems, or neurological issues. If you're on blood pressure meds and feel lightheaded, tell your doctor. Treatment isn't about chasing the lowest number, it's about finding the safest, most functional range for you. In closing, blood pressure is a vital sign, a window into your cardiovascular health. It's modifiable, it's controllable, and the consequences of ignoring it are far too severe to gamble with. Don't wait for symptoms. Don't assume you're fine because you feel fine. Check your pressure at the pharmacy, at your doctor's, or with a validated home monitor. Track it. Understand your numbers. Partner with your healthcare provider and commit, not to perfection, but to progress. Because the most powerful treatment for hypertension isn't found in a pill bottle. It's found in the choices you make every single day. Thank you.